Focal hand dystonia is a neurological disorder that is both complicated and frustrating for those who live with it. Allison McKenzie is a professor of physical therapy right here at Chapman University, and she works with these patients. Thanks for coming, Allison.
Thank you, Dr. Santora. Nice to be here.
Yeah, and you know, I probably have seen this condition before, but I never really had a name to it, and I never really knew what it was. Can you really explain what it is and what the name means?
Sure. Focal hand dystonia is a movement disorder, and most of the folks who have it have characteristic abnormal movements of one or two fingers. So if you look at the words, focal means it's one area of the body. In my case, we work with folks who have involvement of their hand and fingers. Dystonia is a movement disorder that usually is characterized by abnormal contraction of the muscles, so inability to fluidly move your fingers or alternate movements, that sort of thing.
So this would feel different than a stroke where the hand is flaccid, it doesn't move at all, or?
Right, and in this case, for the folks that we see, it's very task specific. So for example, the people that we see have difficulty with very rapid, repetitive, fine, skilled movement. So musicians at the peak of their career, for example, or people who do a lot of computer keyboarding, or accountants at tax time. And it only is involved in that particular movement. So if a pianist is able to do this on a desktop, he or she may not be able to do it on the piano. So it's very, very specific to a particular task.
That's amazing. So the hand can move, but it can't move when it's doing their job or whatever.
That's exactly right, and it becomes very debilitating
Yeah.
if someone's a professional musician and they suddenly can't play their instrument, then you can imagine the effect that has on someone's life.
Yeah, dramatic. Now you have a guitar there. Can you show us?
I
how
do,
that
and I have to apologize. I'm not a
You're
guitarist.
gonna sing and play, or just
no,
sing?
I'll spare you both,
No
but I'll just
dancing.
sort of demonstrate. No, I can't play guitar. In 6th grade, I taught myself Smoke on the Water, but that's about it.
Okay.
But I can show you the kinds of movements. So for example, ordinarily, people can move pretty quickly. I'm not a guitarist, and even I can move pretty quickly and controllably. If I were to have dystonia, I might have inability to move these fingers smoothly. They might curl up abnormally or stick out or tremor, and I just couldn't play in a smooth and fluid motion like I normally can. So it's very debilitating, yet somewhat subtle to try to pick up.
Is there pain involved with it, like a painful muscle contraction? Or?
Ordinarily not. Once in a while when people have been playing for a long time and they feel the muscles cramp up, sometimes, but ordinarily it's pain-free.
And when it starts, is it like every day after that? Once you get it, you're going to have it every single day when you play the guitar?
Yeah, that's the trouble. And our theory is that it becomes sort of learned. And the typical history that we hear patients report is that they're busy performing, getting ready for a big performance, and they're under a lot of stress, and they're practicing 7-8 hours a day nonstop, not resting. They start to notice their movement degrading a little bit, and instead of just taking a break and walking away, they try to force the issue and keep playing abnormally, and the more they play abnormally, the more it reinforces. It sort of gets hardwired in. Yeah.
So if you give those people sedatives or like a beta blocker like Inderal you give for stage fright, would it calm that down at all?
You know, that's beyond my level of expertise, but we have had patients on that, and it does help the tremor. And different kinds of drugs that act on neurotransmitters seem to help mitigate some of the symptoms, reduce some of the symptoms, but it never goes away completely. And you know, we try things like relaxation training, just calming down the nervous system quite a bit, because if you like, I can show you kind of the areas of the brain that are involved with it. And one of the things that happens, so let me get you oriented. This is only half a brain because that's all I have today. It kind of sits in the head like this. So this would be the outer surface, this would be the front and the back. And in the front part is where we see the motor areas. So this is called the premotor area. That's going to be the area involved that helps us with planning movement, organizing movement, getting ready to move. The primary motor area here is what actually initiates the movement. And the area that affects the hands is way down in here. And what we find with dystonia is that the representation of the body in the brain gets disordered. And ordinarily it's a nice orderly sequence, but with dystonia it's kind of jumbled. And often what happens is there's a lack of what's called inhibition, so the brain is a little bit too active. Ordinarily when we move, and you can sort of feel this, as you're moving, just that movement gives your body feedback, kind of a sensory feedback. So you know where your body is in space, you know what you're touching, And that information comes into this region, the sensory cortex. And the two of them have to talk to one another to really control movement. And what happens with dystonia is that communication between the two areas gets a little bit jumbled up and a little bit almost kind of hyperactive. And so we try to sort of calm that down and refine the focus of the motor output as well as the sensory input.
Does any time of brain trauma, auto accident, falling down, could that ever affect that area and set this off?
Well, we don't think it starts centrally in that regard that it's trauma related, but a lot of the people we see have a history of some sort of musculoskeletal disorder, or carpal tunnel, or a nerve impingement, whiplash injury. So we initially thought that might be sort of causative, and that's probably not. It's a little more complicated than that. What we know from the research the last few years is that there's probably a genetic predisposition for it. It's kind of multifactorial in that lots of different factors play into it. For example, if somebody has limited range of motion and they're trying to play a piano piece that's just beyond their capabilities physically, they might be at risk for it. People who are very perfectionistic and somewhat anxious, really driven folks tend to be more prone to it.
You're stretching the limit of
Really stretching the envelope. And these folks are usually working at a speed that's beyond what the normal human brain is really set up to do, sort of way over the edge of what the human capability should be, and that's kind of what tips the scale.
I see, that's interesting. I know we're going to talk about the hand, but are there other parts of your body that can be affected focally by this?
Yeah, cervical dystonia or spasmodic torticollis is one example of a focal dystonia. I'm seeing a person now who has it involving his tongue. People have it of their embouchure. Musicians who play horn instruments can have it. Opera singers can get it in their throat. Golfers can get it in their wrist. Yeah, no, we don't want that to happen. So, I mean, we're still trying to figure out, you know, why is it that some people who do these activities get it and some don't? And most don't, thankfully.
Yeah. Does anybody go through a quiet phase where they don't get any therapy, they have it, and then they go a year and it's quiescent, it doesn't come? It doesn't manifest itself?
No, unfortunately, well, at least not in my experience, I've not seen that. And there are some treatment approaches that involve immobilizing the affected body part and just sort of doing exactly that, calming everything down. And that can help some people short term, but it doesn't have a lasting effect. And one of the problems is that when they go back to do the activity, you know, they're still doing it abnormally. You know, we try to get people to stop doing whatever it is they're doing abnormally initially.
Can you demonstrate what we have here? What do we do with these?
Sure. So one of the examples of focal hand dystonia, one that I talked about was musicians, but it can affect people who do a lot of handwriting too, or it's called writer's cramp. There really is a writer's cramp. My students always accuse me of giving it to them when I give essay exams. But this is more characteristic of sort of having a really heavy grip on a pencil. So somebody's trying to write and they just can't control it and their hand starts to curl or their fingers stick out. So one thing we can do in treatment is to start working on some compensatory strategies. So there's a difference between sort of true recovery versus compensation. So compensation is geared to helping them function, even if it's functioning in a different way. So if I'm a right-handed person, I might switch to my left hand for a while, or I might use a different writing device. This is a sort of an inflatable device that doesn't allow me to push so hard. One of the things they do is they push really hard, and you can hold the grip differently or build up your pencils or pens, so you just can't get your hand into that abnormal grip that it likes to assume. This is a little doodad that can help you use bigger movements. What we find is that people who write with bigger motions like that have less trouble.
And I also saw you had a mirror up. Can you show me how that works? That's very interesting.
This is kind of an interesting idea. We stole this idea from Dr. Ramachandran down in at University of San Diego. He was using this kind of therapy with patients who'd had amputations and were having a lot of phantom limb pain and feeling like they were having uncontrolled movement. And the way we use it with people with dystonia, say for example I had writer's cramp of my right hand, and so as I'm using my right hand it really wants to cramp up and I can't move it normally, and I've completely forgotten what a normal hand looks like because every time I grab the pencil things tighten up. Well, with the mirror, what we can do is have people look at the image.
That's amazing.
Yeah, it's kind of strange, but so now I'm looking at a reflection of my left hand, which looks to my brain to be a normal right hand. So it looks like it's perfectly normal. And I can take them through a series of activities so they can sort of relearn what a normal hand looks and feels like when it's writing. And it's a little disorienting when you first do it. You know, it's sort of hard to appreciate it unless you do it. But it's a way to sort of override the system and use that strong visual input to sort of retrain the brain into a new pattern.
That really works, huh? That's
It
amazing.
does for some folks, yeah, it does.
That's very interesting.
One of the other things that we use is to work on retraining the sensory system, so how people feel, because even though this is considered a movement disorder, what we found in our research is that people have difficulty with complex processing of sensory information. So they can't necessarily tell if you're touching the fifth finger versus the fourth finger, you know, kind of subtle things that get lost. And so one of the things we have them do, for example, we would have their eyes closed and have them just try, if this were my dystonic finger, just trying to explore the domino and see how many dots are on there, and you know, can I feel them all? And as that gets easy, then I add a level of complexity. Try to see, okay, now what's the configuration? How many are those? And then once that gets easy, then I get a smaller domino with shallower holes. Try to feel that. So I'm really working on fine-tuning my sensory awareness. Learning how to read Braille is another way to do that too.
That's
so some of our patients will do
so
that.
it's really a motor and sensory
It
problem.
really is.
It's a feedback mechanism. And
That's exactly right. You hit the nail on the head. Right.
that's very interesting. We're just about out of time. This is an amazing disease process. I've
yeah,
never heard of it.
It's interesting. Unfortunately, for anybody who has to get it, I'm sure they don't really appreciate it.
Yeah,
then.
it could be life-altering.
It really is.
If you have this.
It really is.
Very interesting. Thank
Yeah.
you so much for
Thank
coming today.
you.
I learned a lot, actually.
Great, thank you.
I appreciate it.